everyone, welcome back. Today I'm going to be talking about PCOS and the causes, symptoms, and the long-term risks of having polycystic ovarian syndrome. So to start off, 1 in 10 women today have PCOS and they may or may not have it. That's a huge number and it's just growing. And some of the symptoms you may have, and it may or may not be associated to PCOS. And I'm going to discuss a few of them today, just so you are fully aware of some of the symptoms. So to start off, irregular periods, weight gain, especially in the abdomen, trouble losing weight, infertility, acne or oily hair and skin, excessive hair growth, especially on the face, neck, back, and chest, fatigue, mood swings, depression, anxiety, and bloating, headaches, migraines, thinning of the hair on your head, sleep problems such as insomnia, sleep apnea. Even if you don't have sleep apnea, it can turn into sleep apnea in the future. Fluid retention, which goes along with having trouble losing weight and weight gain. Excess cortisol. This is the stress hormone that your body creates when you're under a lot of stress. This is why you should keep your stress levels at a minimum. Loss of libido or pain during sex, or pelvic pain. Insulin resistance or diabetes. This is just some of the symptoms that you can have when you have PCOS. Some of the causes, now they're not fully sure what causes PCOS, and as of now there's no cure for it. You just have to kind of manage it through weight loss and diet, even though losing weight can be very difficult when you have PCOS. But some of the possible causes of PCOS could be excess stress, environmental, meaning the hormones and chemicals that they pump into our food, and even the chemicals that we breathe on a day-to-day basis while walking down the street. It could be genetic. So if someone in your family does have it, that could be a reason why you may have it. I know if your mother has it, you are more at a risk. I believe the number, don't quote me, but I believe the number is somewhere around 70 to 80% of an increased risk you have at getting it. Obesity from a younger age and increased body fat from a younger age. Thyroid disorders. A lot of people these days have thyroid issues, and thyroid does cause your hormones to be out of whack, because the thyroid is what controls your hormones in your body. So if your thyroid is all messed up, that could be a reason that your hormones are messed up as well. And if you eat a lot of processed food since a young age, if the food that you eat has a lot of additives in it, meaning chemicals, fake sugars, dyes, those are all bad for you, and those are the additives that we're talking about. And that's a possible cause of PCOS. Now, some of the risks for PCOS is sleep apnea, which is when you stop breathing a couple times in the middle of the night. And that can cause you to have fatigue. It can cause a whole other slew of problems as well. Heart disease is another problem coming from PCOS, because of the high blood pressure and high cholesterol levels you could have. Certain cancers, such as ovarian, endometrial, and cervical cancers, especially if you have cysts on your ovaries. Trouble getting pregnant because of infertility or miscarriages. You are also at an increased risk for blood clots, especially if you were on birth control. Those of you may know that if you are on birth control, there is an increased risk for blood clot, but PCOS offers another added risk for a blood clot. And last but not least, stroke. Now, stroke can be a very scary thing for many people. Now, personally speaking, I had a stroke a little over a year ago, last October. And I'm not sure if that was caused by my PCOS personally, or if that was from the aneurysm they found behind my eye. Supposedly there was a blood clot in that aneurysm, and they believe part of the blood clot broke off. Now, I'm not sure if that has to do with the PCOS or not, but it was a very scary time in my life, and thankfully right before I had that stroke, I went vegan, and I'm so glad I made that choice, because now, being that I had the stroke, I feel like I can become healthier now, that I've put the stroke behind me. They've caught the aneurysm in time. They treated that aneurysm, and now I can just focus on living my life happy and healthy, and just kind of dealing with it on a day-to-day basis. And that's pretty much it, guys. I mean, there's so many problems out there, and PCOS is just one of them. And all I can say, from one person to another, everybody can exhibit the symptoms differently. Not everybody has the same symptoms. Not everybody has the same signs or risk factors from polycystic ovarian syndrome. I just know that it's a very difficult disease. It can really lower your self-esteem, especially if you have some of the symptoms that change your physical appearance, such as the facial hair. I personally struggle with that, and it's not fun. Having to shave or tweeze frequently, having to go for waxing, and just dealing with that, and your hair thinning. Sorry. Your hair thinning. You want beautiful thick hair, and you just can't have that. I'm trying to thicken up my hair again. I used to have thick hair when I was younger, but now my hair is just thinning out, and the thinning has decreased, and I just kind of go with the flow. I mean, I eat healthy, I'm a vegan, and I get all the nutrients I can in every day. You just kind of have to count your blessings. And if you guys have any questions at all, please feel free to contact me. And if you want to hear more about this topic, please either comment below or subscribe and like this video, and I'll be sure to post more content on this. All right, guys, be happy, healthy, and stay strong. Bye.